Hi, everyone. I'm Asa Waldstein, and I'm here today to talk about a really interesting warning letter that just came out actually in the CBD space. This warning letter is a great reminder that blogs are considered marketing claims. So blogs, those are the things on commercial websites that commonly talk about ingredients and different clinical studies. Well, the FDA's position on blogs is continuing to narrow. So really, any blog or any information on a commercial website or that links to a commercial website is considered fair game for marketing enforcement. So there are several blogs mentioned in this warning letter, including one titled, How to Use CBD to Combat Holiday Stress. And in that blog, it talks about reducing anxiety and depression. Now, anxiety and depression, that's really a 1-2 punch of enforcement here with the FDA. As I reported on with a video a few months ago, you could see the link in comments. I talk about anxiety claims enforcement is on the rise. It was actually up 95% in 2021 over the previous year. And in 75% of those warning letters, both the words anxiety and depression were used. So really the important point here is be careful with the words anxiety, depression. And really the overall lesson is be careful with blogs. I did do a post, which I'm writing the link in comments about best practices for blog posts. So if a company must use a blog post on a commercial website, be very careful not to use any high-risk disease words, because in the eyes of the FDA, anything on a commercial website is likely considered marketing. This warning letter is excellent. It also talks about CBD as a non-permissible or non-allowed ingredient in OTC topical drugs. Now, I think we remember a couple of years ago, there was a lot of companies using monograph products such as a menthol rub as kind of a way to try to potentially make a claim about pain or arthritis or things like that. Well, that quote loophole is gone. The FDA's position is that CBD is not a permissible ingredient as an active or inactive ingredient in any drugs. So what this means is that if you see a CBD company that's making a claim about pain on any of their topical products, this is likely a drug claim that is not permitted. So steer clear of making any OTC related pain type of claims if CBD is an active or inactive ingredient. Also in this warning letter, a lot of claims made on social media. This should not surprise anyone, including hashtag claims. Now, I'm silly. I'm a goofball. I always get so excited when I see hashtag claims show up in warning letters because it further demonstrates the point that hashtags are considered marketing claims. In this warning letter, there was one on Instagram from a post from about a year and a half ago that cited CBD for arthritis and hashtag anxiety, to name just a few. Also, product tags. So we talked about this, I think, last week or the other week. Product tags, these are the things on websites that attract customers to order products. On this warning letter, a product tag is mentioned again, and the product tag is dog cancer CBD, which is also very high risk. And last but not least, discussing ingredient benefits. If we're talking about ingredient benefits on a commercial website, this is considered marketing or an extension of the label. So we're seeing this show up in more and more warning letters, although there'll be an about the ingredients type section. Well, in this ingredients section, compliant language should be used. So in this warning letter, it talks about orange oil, an ingredient in the CBD product, may naturally relieve anxiety, depression, there's a 1-2 punch again, and inflammation in the body. So friendly reminder that discussing ingredient benefits on a commercial website is high risk, and we also want to make sure that we're using compliant or lower risk language there. Okay, well, once again, I'm Asa Waldstein. So great to talk with you today. Have a wonderful day. Take care.